Namaste and good morning. Uh, I am very grateful to Kaivalyadam Yoga Institute for organizing this online symposium and for giving me the kind invitation to be here on the occasion of this symposium, which is organized in conjunction with their Foundation Day, to tell you about yoga therapy in the management of non-communicable diseases. Now, there are so many non-communicable diseases, but I am going to talk about a few. So let me start that. The conditions which I will be covering in the next few minutes are these 4 conditions mentioned above, and the 5th condition, obesity, which can be considered as a precursor or a pre-morbid condition for the other 4 listed above. Now, in order to talk about these conditions in conjunction or connection with yoga, I want to draw on a very well-known yoga model. This is the Pancha Kosha model, which is beautifully described in the Taittiriya Upanishad, and the descriptions can be attributed to the Vedic sage Yoga Vasishta. According to this, diseases can be categorized as those which arise from the mind, which we call the psychosomatic illnesses, adija vyadi, and those which are other than the mind, like communicable diseases or injuries and so on. Now, if we want to link it to the Pancha Kosha model, this is such a well-known model, so I'll just go through it very briefly. The most tangible level is the physical body, which we can study in physiology and anatomy. Then that goes on to the level of the Annamaya Kosha, which involves breathing and the prana. Then 2 mental levels, the Manomaya Kosha, which is concerned with intuition and emotions. Then an intellectual level where we talk of logic and reasoning. Now, these 4 levels function perfectly. We have bliss, ananda, and harmony. But what if there's disease? This is an interesting model here of how disease arises. If you have thoughts which are not so comfortable at the Vijnanamaya Kosha level, or emotions which are discomforting at the Manomaya Kosha level, then the end result is a distracted mental state called Vikshepa. Now, a number of consequences of this distracted mental state are described in Patanjali's Yoga Sutras, chapter 1, verse 31. One of them is rough and erratic breathing. So this would obviously link with the pranamaya kosha. So we can imagine that as breathing becomes rough and erratic, this is often the first sign in yoga therapy of a disease. And so then it goes on to the physical level, the Annamaya Kosha, and a person manifests with the disease according to their individual predispositions. But on the other hand, one could beautifully turn it around to health and well-being, which is the salutogenic approach. But that's not the topic for today. Now coming to the first condition in the list, cardiovascular disease. There are 2 very wonderful lifestyle intervention programs, the Dr. Dean Ornish program for reversal of heart disease, and another program also from the US, the Benson Henry Mind Body Institute Cardiac Wellness Program. Especially the Dean Ornish program, which is well known for actually showing for the first time that heart disease can be reversed, was the basis for many programs to be planned and researched across the world, including one in our own country by the well-known cardiologist, Dr. S.C. Manchanda, who at the time was in AIMS and showed that a lifestyle intervention, rather like the Dean Ornish program, with a little more emphasis on other yoga practices other than only meditation and breath, also reversed heart disease. So let's look more closely at the Dr. Dean Ornish program. This has 4 main points. Our nutrition, or what we eat, where the emphasis is principally on plant-based, high-fiber food, which is low in saturated fat, managing stress, and you can see here there's a nice picture of a silhouette of a person in Padmasana. So yoga is definitely a good, healthy coping strategy. How much we move, that's down there, and particularly aerobic activity, and of course, the amount of support and love a person has in their life. So this program, which has these 4 cornerstones, was shown to actually reverse heart disease. So people who had angiographically proven blocks in their coronary vessels were able to have it reversed, no more blocks, so that their blood supply to the coronary muscle was good. This was a most effective example of management, and these elegant studies were published in the 80s in a number of journals like New England Journal of Medicine, JAMA, and so on. But can it help in prevention? This was a study published in 2014 in PLOS1, which looked at 580 people who had already had an acute myocardial infarct and undergone some level of intervention. like a coronary artery bypass graft or percutaneous coronary intervention. Then after this, they went through either one of the programs, okay, a high body mass index or change in the lipid levels. So this was shown with both the programs and was present at 2 years. So thus we see that cardiac conditions can be managed and prevented through yoga. Let's move on to the next condition. Just a second. I request the host to help me move the slide. Okay. Chronic obstructive pulmonary disease. This is a condition which is particularly important now, because we're all talking about pulmonary risks in the present pandemic. Way back in 2 years ago, and even before the pandemic arose, COPD was considered a condition which would be the third leading cause of death in 2020, not related to the present pandemic. And so it is an important condition, but is much under-researched for yoga. This review was carried out as a systematic review and meta-analysis by Holger Kramer and his colleagues from Germany, which looked through several databases and compiled it from 11 RCTs, looking at 586 patients of COPD. What they find was mainly improvement in pulmonary functions with yoga, which is very important, and people were able to exercise without getting dyspneic or breathless. However, this is a very important point. Safety details were inadequate, which is a characteristic for many yoga therapy studies. With this, it is sufficient to say yoga can help COPD, more research needed. Moving on to another condition, type 2 diabetes mellitus. There is lots of research on this, and this meta-analysis and systematic review, more of a systematic review, was conducted by Kim Innes and her colleagues in the US, which searched through 9 databases, looked at 25 trials, of which 12 were RCTs, and covered 2,170 patients totally, who all had type 2 diabetes mellitus, yoga therapy for more than 2 weeks, and used quantitative data. On the whole, they found that when you use yoga for type 2 diabetes mellitus, there is definitely an improvement in glycemic control, very important. Body composition levels become normalized. Lipid levels again become stabilized, particularly HDL levels which are low get raised, and cholesterol levels which are high go down. And the medication needed to control the blood sugar levels becomes less. So this is effective management. Let's see prevention. This was a study which was part of a large nationwide trial, which is conducted by R. Nagaratna and her colleagues. This particular sample used 3,366 pre-diabetics. They were all over the age of 20 years. And they had glycated hemoglobin levels in the range 5.7 to 6.49%, which meant that they were at risk of developing diabetes in the future. Now then, they were then randomized as a yoga and standard care group and followed up for 3 months. At the end of 3 months, 52% of the yoga group now had glycated hemoglobin levels in the normal range, that is less than 5.7%. So this was a very good change. Pre-diabetics became normal. The number in the standard care group was considerably less, 39.9%, who became normal. And this between groups difference was statistically significant. So we see that diabetes, like coronary heart disease, can be prevented through yoga. Moving on to another condition, cancer. There have been a large volume of studies coming from the MD Anderson Cancer Center in Houston, Texas, and most of them led by Lorenzo Cohen and his team. A large number of studies have also been done by Dr. Lorenzo Cohen in collaboration with the SVRSA University in Bangalore. There are other studies also, and a whole lot of 10,000 plus patients from 20 countries all over the world have been researched for an integrative oncology program for cancer, which of course includes yoga as a therapy, because that's the topic we're talking on. So what are the benefits? There were these benefits, mainly, first of all, improvement in the psychological state with a shift towards positive psychology, better quality of life, and overall more optimism and life satisfaction, mental well-being. Immune functions changed so that chronic inflammation was less. Fatigue also became less, and undesirable swelling due to lymphedema became less. Side effects of chemotherapy and radiation, especially those related to the GI, like nausea and vomiting, were also lower. Cortisol responses indicating extreme stress were less. Sleep was better, weight improved, because weight is often less. So there are definite benefits for cancer survivors practicing yoga. But many people ask, what about regression? Are there any instances where a tumor completely disappears? So I quote this early work done by Nialis, a Melbourne-based psychiatrist, who showed that when people, even with advanced stage cancer, and he particularly looked at this, practiced meditation intensive meditation, then there is total spontaneous regression. Can we say that these are RCTs? No. Are they scientifically proven? Well, there is documentation and they are worth looking at. So leaving that aside, I now come to the last condition, obesity. Obesity can be considered a pre-morbid condition for many others, like for diabetes, for hypertension, for heart disease, for dementia even, and also for cancer. So we have studied it in Patanjali Research Foundation as a nationwide campaign again, where we looked at baseline follow-up, 3 months, 6 months, 9 months, and 12 months. What we had published at the time was mainly the 3-month follow-up, but we now have the data for the subsequent, including 12 months, though there's considerable attrition. Overall, the results remain the same, showing that central obesity, weight around the waist, reduces, whether it's 12 weeks or at the end of 1 year. Risk factors to develop a cardiovascular event go down. Leptin levels, which signify our appetite and feeding regulation, become better. And overall, people who are overweight or obese and who practice yoga have a better quality of life and a better image of their body. It's very important because if there is a psychological state change, people are more likely to adopt and adhere to a yoga practice. And so we see that there are lots of studies on yoga for non-communicable diseases, but I want to fit this in. We need more evidence. Is the level of evidence adequate? So if we go according to this study, which was published by the NCCAM, at the time it was called NCCAM of NIH in 2003. So that was a real guideline for how CAM therapies, including yoga, should be shown to have evidence. There are 2 dimensions, efficacy and safety, which you can see in the left column. And all of them should be documented with at least 3 RCTs coming from more than one research team with a minimum of 50 patients each. And this is the minimum needed to recommend any condition in conventional healthcare settings. Do we have it? Not really. We have a lot of other evidence which we need to gather and publish as level of evidence trials, and this is an endeavor in which we should all participate. So a level of evidence is needed, but we should also question, for something as lifestyle-oriented as yoga, do we need a new research paradigm going beyond the RCT? So I'll just leave that question here. Don't have time to go into further detail, and end by saying, you also need at all levels, and I know Kaivalyadam has a wonderful history of doing that, integrating evidence and research in all levels of yoga education so that people come out with a good education balance. And these were 3 books which I have been very happy to be involved in as a co-editor, which include some degree of evidence in different conditions. But I also know that there are so many more books, so many publications, and it is important to emphasize that all people involved in yoga, whatever the level of involvement, should be aware of the evidence, which is of course part of the endeavor of this nice symposium. So thank you. At this stage, if the organizers would like to share any questions with me, I'll be very happy to take them.
Dr. Tellis?
Yes.
No, yeah, thank you so much. That was a lovely speech. And a lot of time, Dr. Tellis, people don't know what non-communicable diseases are. So I, as a host, would like to actually ask you a question. If you can, give us few more names of the diseases that people think sometimes are not able to differentiate between communicable diseases and non-communicable diseases. If you can just highlight a little bit more. In a very layman's term.
Communicable diseases are those which can transfer easily from one to other, particularly infections. Right. We are all aware of the most overriding the infection at the moment, the COVID-19. That's a communicable disease. But there are other, it could be even scabies, which could be skin infection. So, so that's where cleanliness, it can be something like that. It can be measles, it can be mumps, it can be tuberculosis. So there are all these infections, whether they're caused by a parasite like scabies, or whether they're caused by a virus, like we all are talking about a virus now, or mumps or measles or polio, other viruses or viri, or bacterial conditions like tuberculosis. These are communicable. All the other diseases are non-communicable. And that is the whole, now not all the non-communicable diseases can be managed through yoga, but those which have a psychosomatic component can.
Okay. Ma'am, we do have some questions from the audience. I'm going to read it from the chat box. How would you rate the quality of yoga research in India? So there's somebody from the audience called Udit and he's asked you this question.
Right. Well, that's a good question. Luckily for us, we can feel happy that the quality of research from India is very good. We see more and more randomized control trials. As you saw in my presentation, I quoted a lot of work from India. So the quality of work is good. We can be happy about it in India. Do we need to improve? All over the world we do. And that's where the level of evidence is needed. So the quick answer is the quality of research in India is very good. We do need to do one thing though. We need to have a uniformity in reporting. So if we talk about a system of yoga, it should be understandable to people across the world, not just for India, anywhere. If we can revert to the traditional texts and report a practice, it'll be very easy to understand all over the world.
Wonderful. Thank you so much. That was a great answer. I think we do have one more question. So the audience who asked the question said, thanks Dr. Tellus for a brilliant exposition. That's great. And namaste ma'am. Let me read out one more question. It would be great if you get names of books referred to. I think, yeah, I did mention to our audience that you have written 7 books and around 198 research papers to a credit. Can you give us the names of those 7 books?
Okay, at least I have mentioned the 3 which I put up on the slide. One is the Principles and Practice of Yoga and Healthcare. So I brought that out with 3 of my colleagues, Satbir Khalsa, Dr. Satbir Khalsa, who I think is involved in this, and who's often speaking at the Kaivalyadam, I know.
Yeah, he's joining us.
Joining us, yeah. So that's a wonderful book, which was really led by Satbir, Handspring Publishers, with Lorenzo Cohen, who I mentioned in MD Anderson, and Timothy McCall, who's also from the US, and myself. We are looking to bring out a 2nd edition of the book in 2022. We are having a discussion on that in the following month. Apart from that, I have actually, with colleagues from Patanjali, brought out 2 books published by Pennsylvania-based publishers IGI Global. One was in 2018, and one is released this year for actual formal release 2021. One is Psychophysiological Effects of Yoga in Health and Disease, or Psychophysiological Effects of Yoga Practices. And the other is Evidence-Based Yoga Practices and Their Applications. The publisher is IGI Global.
Wonderful. Thank you. That was a great book referred by you, and I'm a student here in Kevaladhama, so I'm going to make sure that I do also pick up those books. I'm going to order them online. So there's one more question that's come your way. I'm going to read it out. It is from Sri Subodhi himself. Do yoga interventions in the RCTs have some fundamental similarity in their principle? This question has come to you from Sri Subodhi Tiwari.
Okay, it's a nice question, of course. And yes, sometimes there is a similarity in that all of them attempt to address the person as a whole. It's called the real, which we all talk of, the holistic approach. So, for example, all RCTs, whether it is for COPD or whether it's coronary heart disease or diabetes, they don't look only at the problem, like a joint swelling in arthritis or raised blood sugar levels in diabetes. They look at the person as a whole. So, is there something wrong with the breath? Then there are breathing exercises. There are the pranayama practices. Is there something wrong with the person's thinking? So, is the person speeded up, or is the person dull and lethargic and depressed? So when most yoga interventions in RCTs have this fundamental similarity in the principle, that is a holistic approach to correcting an abnormality in the person. But there onwards, the interventions deviate slightly. For example, in the Diabetes Mellitus, if the emphasis is on the glycemic control, there may be one set of practices. If it's a Diabetes Mellitus and the emphasis is on, say, autonomic nervous system, it may be another set of practices, and so on. So it's, yes, fundamental similarity is treating the person in a holistic way. Thank
Thank you so much for answering that. Shubhoji is here only and he's watching it from his office. So I hope he got his answer. And this was the last question, ma'am. And thank you so much for being with us. You joined us on time and you actually finished your talk on time. And thank you so much. And
Thank you.
for all the audience who have joined us now, all these talk sessions are available on the YouTube. You can always watch it later also.
Thank you.
So let me just move on to our next session. I'm going to say thank you to Dr.
Thank you
Tellis.
again. Yes.
Thank you so much, ma'am.